Hello, thanks for joining us today. I'm Dr. Otis Kirksey, the director of the Prince Hall Shriners National Community Health Initiative. Over the past 12 years, the Prince Hall Shriners played a major role in improving the health of people living with diabetes through our collaboration with the American Diabetes Association. We're so pleased that this year, under the leadership of our national president, the Honorable John T. Chapman, our Imperial Potentate, we have now expanded our footprint in the area of health promotion to include other areas of concern that disproportionately impact people of color. You know, there is a tremendous need for African American men to talk more about their health. And a topic that doesn't get a lot of attention and needs to be discussed more is that regarding prostate health and prostate cancer. To help shed some light on that particular topic, we're more than pleased to welcome Dr. Giddens, who's a national recognized expert on men's sexual health, to join us and talk a little bit about this topic. Welcome, Dr. Giddens.
Thanks for having me, Dr. Kirksey. It's really a pleasure to be here to speak to your members about this such an important topic. As you know, I'm a urologist, a board-certified urologist, and I focus on sexual medicine for men and as well as women. But we also talk a lot about prostate cancer and some of the screening methods and some of the treatments of prostate cancer. So I'm really excited to be able to share this with you.
Great. Let's just jump right into it. So this evening, what we would really like for you to provide some more some detailed information regarding prostate health, prostate cancer, and what Black men really needs to know regarding this topic. Can you share with us a little bit about what it is, what types of prostate cancer exist, what are the statistics that are currently present, what care is necessary for patients with prostate cancer, and talk a little bit about the clinical trials that are available and how important it is for men to at least consider participating in those trials if they need or if their providers recommend it. We also want you to talk about the different phases of clinical trials and how that leads to drug being put on the market.
Thanks, Dr. Kirksey, again. As I mentioned, today we're going to talk a little bit about prostate cancer. So before we talk about prostate cancer, I wanted to discuss what the prostate gland is and where it is in the body. So the prostate gland is right underneath the bladder, and it's right in front of the rectum. As men grow older, the prostate can be enlarged, something called BPH, or in some cases, it can develop into prostate cancer. So prostate cancer begins when cells in the prostate gland start to grow out of control. And when it grows out of control, it can destroy the prostate itself and the tissues or the surrounding tissues, or it can metastasize. I mean, it can travel to other organs and cause destruction there. So the most common form of prostate cancer is adenocarcinoma. Adenocarcinoma affects the glands of the prostate. There are other types of prostate cancers, small cell carcinoma, neuroendocrine tumors, transitional cell carcinomas, as well as sarcomas, but these are very rare. For the most part, adenocarcinoma is the most common form of prostate cancer. So just discussing some of the stats, prostate cancer is one of the leading causes of cancer death in the African American community. It accounts for 2.3 times the amount of prostate cancer deaths as compared to white men. 1 in 6 African American men will be diagnosed with prostate cancer. So this shows that, you know, as an African American male or African American, you will probably know somebody that had prostate cancer, either it be an uncle, a father, a cousin, a brother, or a friend. So in terms of prostate cancer, And there is something that we do called screening. And for screening, we do a digital rectal exam as well as a PSA. These are just ways to try to get to the prostate cancer before it becomes symptomatic. There's other ways that you can do that will lower your risk. There's nothing that we can do that prevents against prostate cancer, but in order to lower your risks, there are things such as eating a healthier diet and exercising, which may lower your risk of prostate cancer. In terms of clinical trials are research studies that involve human participants. Clinical trials help researchers better understand a disease or condition. Clinical trials help researchers find new treatments for people in the future. They also are crucial steps in finding ways to improve treatments for diseases and health conditions. Lisa Valenteria is a Black Health Matters spokesperson, and she really summed it up nicely. She stated, when segments of the population are not included in clinical trials at levels that meet statistical significance, it is impossible to determine if the therapy in question will work equally, better, or worse for the population which it is studied. So this is really the reason why it's important for African Americans to discuss clinical trials with their physician as well as participate in clinical trials, because we want to know if new investigational medications are going to be helping us and our population. So there are metabolic differences among ethnicities that cause drugs to act differently. Without monitoring therapies by race and gender, outcomes can vary, and these this could be further disease progression, unwanted and dangerous side effects, as well as increased mental and emotional toll on patients and their families. So there are several reasons why minorities do not participate in clinical trials, and really the main reason is that we're not really asked, and we're not asked for a number of reasons. There may be an assumption that we're unwilling to participate. There may be some issues with language and cultural background, but for the main reason is we're really not asked to participate in these trials. And so we have to really inquire about these ourselves. So clinical trials are a crucial step in finding new ways to improve treatment for diseases and health conditions. So clinical trials are divided into phases. Phase 1 is the first step in testing an experimental therapy in humans. The goal of phase 1 studies is to determine safety, the appropriate dose, and how the experimental treatment is processed in the body. In phase 1 trials, the participants are usually a small group of 20 to 40 men or women. In phase 2 trials, this is designed to learn more about side effects of the drugs. In phase 2 trials, it continues to test the safety of the drug or a combination of the drugs and begin to evaluate how well the investigational drugs work. These trials have more participants, and they range between 25 to 100 members. In phase 3 trials test how an investigational drug or new surgical procedure compares with the currently approved standard treatment. Phase 3 trials are randomized, which means that participants are assigned either to the experimental therapy group or to a standard treatment group by chance. Phase 3 trials often enroll a large number of people, usually 100 to 1,000 patients, and are used to determine if the investigational treatment is more effective than the standard of care. And if the investigational therapy is found to be effective and meets safety requirements, an application will be marked to set for the FDA approval. So what should you know if you're interested in participating in a clinical trial? You want to know what the purpose of the trial is and what will happen to you. What kind of drugs, tests, and treatments will you receive? How long will the study last? How many times will you have to go to the facility administering the clinical trial? How will they keep your information private? And what happens when the study ends? In conclusion, clinical trials are important because you may have the access to experimental drugs and interventions before they are widely available. If the study drug is a success, you are among the first to benefit from it. You also have the opportunity to make a valuable contribution to research, helping other people diagnose in the future.
Thank you, Dr. Giddens, for chatting with us today about prostate health, prostate cancer, and the importance of clinical trials among African American men.
So one of the questions that a lot of participants, that your members may want to ask is, what is a PSA? So a PSA, it stands for prostate-specific antigen. It's a screening test that we do. In terms of screening tests for prostate cancer, the AUA recommendation for PSA is between 55 and 69. But African Americans are high risk, and so we do recommend that African Americans have their PSA checked between 40 and 55.
Dr. Giddens, can you talk a little bit about the time diagnosis and survival rate, how important it is, early diagnosis, and how that leads to better survival rate patients with diagnosed with prostate cancer?
Yeah, so just like any other cancer, the earlier we diagnose, the better. And the same holds true for prostate cancer. So prostate cancer is graded on low, moderate, and high risk. And so the idea is to try to catch men in the low risk category, because the low risk category has the highest rates of success.
Great, thank you.
Another question that some of your members may, and I see they're asking here, is types of treatments for prostate cancer. So there's a number of treatments that are available for prostate cancer. Some of them is in the category of observation or active surveillance, and that's when what we do is we'll follow a patient over time. We'll look at their PSA, we'll do rectal exams, and then we'll look at prostate biopsies, and we'll make sure that the prostate cancer is not advancing. If it is advancing, then we'll have another discussion about possible therapy. Other major types of therapies are surgery, and surgery could be divided into robotic prostatectomies, or actually they can do an open prostatectomy. That's when we make an incision. There's also radiation that's possible. So there's two different types of radiation that we'll use for prostate cancer. One is external beam radiation. That's when we use particles to destroy some of the prostate cancer cells. And the other type of radiation is called brachytherapy. And brachytherapy is when we place seeds into the prostate that have a radioactive activity. Other types of therapy are hormonal therapy. And hormonal therapy is what we use usually when the prostate cancer has evolved outside of the prostate. And the hormonal therapy will lower a man's hormonal levels to combat the prostate cancer. There's also other types of therapies like cryotherapy and immunotherapy that are also available for certain types of prostate cancer, certain risks.
Should you always talk to your primary care provider before, or your physician before agreeing to participate in a clinical trial?
Yeah, I think for sure, and it's going to depend if your particular primary care provider is offering a clinical trial. So I think that's the first place to start, is with your primary care provider. If your primary care provider is not providing, is not part of a trial, then they may be able to refer you to the closest university or another site that might be offering a trial for prostate cancer. But I think that's a great place to start.
Okay. Now, I have another question as it relates to clinical trials, because you mentioned a word that some people may not be familiar with. That word is placebo. You kind of define that. And another question I have related to that is, if a person agrees to participate in a clinical trial, what is the expected duration? How long do those clinical trials last?
Okay. So to answer your first question, placebo. So usually with a clinical trial, and it depends on the phase, so the drug at hand that we're studying is compared to sort of a it's I would say it's like an artificial drug. It's not a drug at all. It's actually could be saline, or it could be, in some cases, if it's a pill, it could be like a sugar pill of some sort, where that's compared to that non-active active treatment. And in those situations, because we want to make sure that the drug is actually working. And so we want to make sure it's working, and it's working compared to a non-active form of the modality or drug. In terms of, what was the second question? I'm sorry.
How long do these clinical trials last?
So, the clinical trial, it depends on the study.
Okay.
Clinical trial, I mean, it could last, a matter of weeks, months, or years. It just really depends on the clinical study.
Great. Now, if I'm involved in a clinical trial, do I still see my primary care provider, or how does that work?
Well, it would depend if your primary care provider is conducting the study.
Okay.
If your primary care provider is not conducting the study, so say you go to an alternate site, that's going to be the person that's that's the person that you're going to be followed through with.
Okay, great. All right. And one final question: what type of care team should I expect to interact with if I participate in a clinical trial?
So once again, it depends on the clinical trial, but oftentimes you'll have a principal investigator that's there, that's the person that's overseeing the trial. You'll see nurses, you may see nurse practitioners or MAs, depending on how the trial is set up. But you can guarantee that they're all there in your best interest to monitor for any side effects, and to discuss whatever they're studying in full detail.
So when we talk about clinical trial, is that the same thing as a research study?
So a clinical trial and a research study, well, in terms of research studies, there's so many different types of research studies. There could be observational research studies. There's these things called retrospective studies, where they actually go back through data and they look at effects of whatever they're examining. But a clinical trial is really set up in those phases, as I mentioned. And as I mentioned, clinical trials are looking for efficacy, safety, and they're also looking to compare that drug or modality versus the standard of care.
Okay, thank you. Do you have a recommendation on how one should begin a dialogue with a loved one who is hesitant about joining a clinical trial?
Well, I think it's an individual decision, and that's the first part. And with clinical trials, someone has to be ready to undergo a clinical trial. So they want as much data as possible. They want to understand what the drug is that they're being tested for, what the disease is. But in terms of hesitancies, African Americans, we do have some hesitancy when it comes to clinical trials because of the Tuskegee experiments and that were conducted in the 1930s. Things have really changed since then. A lot of the trials all the trials are really safe. They're looked at by a review board, and we don't have those same problems as we did back in the 1930s, because a lot of different recommendations and protocols have to be followed currently.
So, Dr. Giddens, you mentioned earlier about the placebo. If a person has advanced disease, would they have to be concerned about not actually getting a treatment and instead getting a dummy pill or fake treatment?
Yeah. So in clinical trials where we're looking at advanced diseases, that person with advanced disease will always have an active treatment. All right. So at that point, they'll have the active treatment. where the other arm may have just the investigational treatment and the active treatment, but the active treatment is going to be consistent throughout.
Great, great. Well, thanks so much for chatting with us today regarding prostate cancer health, prostate cancer disease, and the importance of clinical trials to African American men.
It was my pleasure. Thanks for having me. For more information about clinical trials and to see if you're eligible to participate, you can visit bmsstudyconnect.com, which is also listed in the screen below.
Thank you. And we would like to thank our partners, Black Health Matters, Bristol Myers Squibb, and we want to also remind you to share this content to those who you care about. Thank you.